I'm Dr. Ora Rozengarten. I'm the chief of the medical gyneco-oncologist unit in the Shaarei Tzedek Medical Hospital. And we deal a lot with ovarian cancer and all other gynecological cancers here in the hospital. So when we recognize a woman who has a BRCA mutation that has not been ill yet, the advice is to follow very closely. Women with BRCA mutations should be followed since the age of 25, which is young, but still, since those mutations can cause cancer at a very young age, it's very important to follow. They need to be followed both for the breast and the ovaries. As for the breast, we leave it apart, but for the ovaries, we are advising having an ultrasound every 6 months and also a C125, which is a blood test once every 6 months. And as soon as the woman has finished planning the family, the ultimate advice is to remove the ovaries in order to avoid ovarian cancer. Again, I must state that those women may have ovarian cancer at an early age, and ovarian cancer is difficult to diagnose at an early stage. It might be a deadly disease, and this is why it is very important both to follow and to remove the organ that is at risk as soon as possible. It is advised to be done at the age of 35 or more. If a lady wants to have more children, she may have still, but be followed again, but not later than the age of 40, remove her ovaries. A young woman who goes through oophorectomy, which is removal of the ovaries, may experience menopause very early. The menopause is both symptomatic, which means she may experience hot flashes, fatigue, joint pain, etc. And this is also a risk for later on cardiovascular risks and things of that kind. So those women may use, and it is even advised to use, hormonal supplement for a period of a few years in order to replace the hormones that were secreted by the ovaries in order to protect and also have a good quality of life for these women. When a woman is diagnosed with ovarian cancer, if she has not been tested before for BRCA, she must be tested right away. There's two important reasons for that. First of all, the woman herself. The treatment may be different for a woman who is a BRCA carrier. We have new drugs today that have been designed specifically to fight cancer who are BRCA driven by the mutation, and those women may get a treatment that otherwise they may not. It's true that some of the women that are not carriers also may get this treatment, but the main effect is for BRCA carriers. The other thing, of course, is testing the rest of the family. As soon as a woman is diagnosed as a BRCA carrier, it is very important to test all the rest of the family to see if anyone is diagnosed in order to save lives, as we said, follow very closely, remove organs that are at risk if possible, and avoid disease and death. If we have a young couple and prefers not to pass on the mutation to the next generation, if one of them is carrying, of course, the mutation, it might be either the husband or the wife, we may have a test that allows us to choose a fetus before it is implanted. PGD is pre-gestational diagnosis. We have to use a procedure of fertilization outside of the body. The man and the woman would contribute the sperm and the ovum. The fetuses would be formed in the labs, would be tested as early as few cells of the fetus, and then we can choose the ones that are not carriers of BRCA and implant them into the uterus by a procedure and allow having a healthy baby and a good pregnancy. This is a way of preventing the passing on of the BRCA mutation and the risk of having children that might also have cancer. If a woman is known to be a mutation carrier, I really ask to remove the ovaries before getting this disease.